to present the data from the effectiveness and safety of vaginal microbicide 1% tenofovir gel for the prevention of HIV infection in women. The purpose of the CAPRISA 004 trial was to assess the safety and effectiveness of 1% tenofovir gel. The dosing regimen that was used the acronym for that is the BAP24 regimen, and it's a covalently related gel use dosing regimen. It comprises the insertion of one gel up to 12 hours before sex, a second gel as soon as possible, but within 12 hours after sex, and no more than 2 doses in a 24-hour period based on existing safety data at that point in time. It's a proof of concept, double-blinded, randomized, placebo-controlled trial. We enrolled high-risk HIV unaffected women reporting 2 coital acts in the past 30 days. And these are known high-risk populations from pre-trial feasibility studies that we conducted at the 2 clinical sites. It's an endpoint-driven trial with 92 HIV endpoints. So of the 889 enrolled participants, 445 were in the tenofovir gel arm, 444 in the placebo arm. 15 were lost to follow-up in the tenofovir arm, 8 were terminated early, 10 lost to follow-up in the placebo arm, 12 terminated early, 1 died. So in terms of assessing the effectiveness of the gel in preventing HIV infection, we had a total of 98 HIV infections, 38 in the tenofovir gel arm, 60 in the placebo arm, translating to an HIV incidence of 5.6 in the tenofovir arm per 100 women years and 9.1 in the placebo arm. Another way of looking at this is a 39% lower incidence rate in the tenofovir gel group. This data, we have a range of protection between 37% to 45%, and each of these analyses yields a statistically significant result.
Struck by the lack of any degree of resistance that was noted from the application topically of this particular drug. That was really quite encouraging. There are a lot of important things about that, namely the concentrations that you can get in the vagina compared to the concentrations you get in the plasma really tell you that you're getting a real whopper of an effect locally, but you're not getting any problem of resistance systemically, which is sort of the best of all possible worlds. There was a certain feeling of ease and pleasure as a scientist for me to look at data that no matter how you slice it, it's statistically significant. You know, intent to treat, per protocol, modified intent to treat, the data are significant. That's important. The first thing I'm going to do when I go home, when I talk about prevention, I have slides that say these are proven prevention measures that have a concept that we feel comfortable about. And then the next slide is a bunch of prevention measures like a vaccine or what have you that the data are accumulating, but we don't really have a proof of concept. So as soon as I get off that plane, if I'm still awake, I'm going to start changing those slides around and take microbicides out of the non-concept proven to the concept proven slide. And I got to tell you, for many, many years, following and being involved in this field, that's going to make me feel really good.
I want to conclude with just 4 points. First, we all recognize and understand the importance of women, and in particular young women, bearing the brunt of the HIV epidemic in Africa. Tenofovir gel potentially adds a new approach to HIV prevention as the first that can be used and controlled by women. It can help empower women to take control of their own risk of HIV infection. We take the view that CAPRISA 004 study is the first step. Additional studies are urgently needed to confirm and indeed to extend the findings of this trial, both for safety and effectiveness. Once confirmed and implemented, tenofovir gel has the potential to alter the course of the HIV epidemic. Mathematical models show and provide estimates that if we could implement tenofovir gel in a way similar to the way in which we did it in the trial, we could prevent 1.3 million new HIV infections and over 800,000 deaths over the next 20 years in South Africa alone.
For women where abstinence is not an option, where they are faithful but their partner may or may not be, and they cannot get their partner to use agree to female condom use or use a male condom, we have nothing else to offer them. So there's no behavioral disinhibition in terms of protecting themselves. I think that's a big difference. This product gives them something versus nothing.